live. So we have this monthly session every 15th of the month. And during this YouTube live, basically, we have different experts who come in and we have discussions on health related topics. This is basically an endeavor to increase the awareness among the public about health related conditions, as well as to reduce misinformation regarding various uh, health related topics. So today we have Dr. Shivraj. He's a consultant physiotherapist here at Optima. Thank you, Dr. Shivraj, for coming on to the YouTube live.
Thank you so much for the introduction. Good evening, everyone. So today we are going to discuss about winter wellness, like tips how to manage your body's stiffness and like what and all things we can get some education and what to do for that. Yes, sir. So we can proceed.
Yeah, so definitely it's the need of the hour because there's a cold wave that Karnataka is going through, and we've all been, you know, suffering from chill temperature, suffering in the chill temperature for the last
Mhm.
almost 1 to 2 weeks. And according to the IMD, it's likely to last for a few days longer. So, whenever winter comes, many patients become concerned. In fact, I've had many patients who have had sort of job opportunities, let's say in Germany or in other countries, and they have not gone there because they're scared that because of the winter, because of the cold weather, their pains are going to get really bad or really worse. So, that is for arthritis patients. We'll leave that aside and we can discuss that later on. But general public also feels that once there's winter, they feel that their whole body is stiff. So why does that occur, Dr. Shivraj? Would you like to explain?
So yeah, as temperature falls around us, our body definitely adapt or go through with some physiological changes as well. So our normal body temperature is somewhere around 336 or 37 somewhere, and if this year winter is giving some cold days. So in this winter specifically, we have seen multiple patients who are coming with complaints of some body stiffness, or whenever I'm waking up in the morning I'm feeling this joint stiffness or some body stiffness or some aches and pains in the body. So there are multiple reasons around the temperature is dropping down around us, will create multiple things which is specifically for joints and muscles. So in muscles, first of all, blood flow restricts because our vessels around muscles and everywhere where blood supply is going, that got little constrict, it will got go little narrow. So that will reduce particular blood flow to that particular muscles, and eventually you'll start getting little stiff and tight muscles because it is not having enough blood supply or nutritions or anything for the contraction. Second, things like joint related stiffness. So in each and every joint, which is most of the synovial joints, which is having some synovial fluid in the joints, so which fluids resemble us like coconut oil or some honey related viscosity. So in winter especially, because of reduced temperature, our synovial fluid also little thicker. It turns in little thicker viscous fluid, which will eventually increase lot of friction or difficulty to move the joint very smoothly. So whenever we are waking up in the mornings, those joints will be little stiffer because of reduced blood supplies to the muscles and increased viscosity of this synovial fluids. So this combination of multiple factors will eventually leads in this kind of signs and symptoms. So we can definitely go deep down and how to cope up and how to reduce those symptoms, or what are things we are going to discuss in this. So yeah, we'll
Session.
go forward with that.
So, thank you, Dr. Shivraj. I think that was very helpful. So, basically, the as you said, the blood supply to the muscles gets reduced, and the fluid in the joints becomes thicker. And because of these two reasons, the feeling of stiffness increases in the joints and in the muscles, and that is what the
Yes, yes.
patients experience.
Yeah.
But there are other parameters, especially in patients with rheumatoid arthritis and osteoarthritis. There has been a lot of research done that does the weather actually play a role, and people are still not sure. But there is something called as barometric pressure. So that is the atmospheric pressure, especially when it is windy or when it is raining. So then the barometric pressure comes down. So at that time, for example, you might have seen that when there is a wooden door at home, during the rainy season or something, that wooden door will become a little bit stiff because it will expand. So scientists feel that when there is a drop in barometric pressure, the soft tissues in our joints also expand a bit, and because of that, there can be a little bit of stiffness that patients can develop and slight worsening of the pain also. However, the relation between worsening of the disease and weather is still not very well proven. But one thing which is very common during cold weather or during rainy weather is that our mood definitely goes down. So this has been proven. In fact, there is a name for it. It's called the seasonal affective disorder, SAD, and it is well known that when our mood goes down, definitely our sensitivity to pain also becomes problematic. So. That could be one way in which the weather can affect how much pain that we are experiencing by reducing our mood. So we spoke about how the reduction to blood supply to the muscles can cause stiffness in the muscles. The thickening of the synovial fluid in the joint can cause stiffness of the joint. In addition to that, we spoke about how reduction of the barometric pressure, the atmospheric pressure during rainy season, can worsen the sensation of pain. And in fact, the change in season can also reduce our mood, and because of the reduced mood, also patients can sometimes experience increased pain. So those are the things uh, that causes the worsening of the symptoms, especially joint pain and stiffness and muscle pain and stiffness during winter. So one thing that patients commonly say during this time is, in fact, they want a solution for this, right? So we will discuss about the solutions, different solutions, but one of the most important solution is, Dr. Shivraj, can you explain what is the most important solution for muscle stiffness?
Yeah, so in winter we, very less likely to move, because because winter is that lot of low temperature is going around. We don't want to move much. So that is, basically naturally we are tends to protect our body in cold winters. We'll literally slouched and, little guarding ourselves to, against the reduced temperature. So that will definitely, changes your lot of biomechanics mix, and as well as your muscles are tight, it will definitely affect your all the joints as well. So there are multiple, rituals, or some activities you can make a routine daily, in which we includes a lot of, warm up or some warming up exercises whenever you are waking up in the morning. So
So,
initial thing.
Dr. Shivraj, before you mention that, this is one thing, thank you so much. This is one thing that I wanted to highlight, because many patients, when they come for follow up, and when I ask them, like, are you exercising? So they say, no, it is winter, and that is why I'm not exercising. So many patients feel that winter is a time that they should not exercise, or they should like rest for some reason. So, in fact, what you are saying is that the opposite is true, that it is more important to
To
exercise
move.
during the winter
Yes.
to maintain normal flexibility and reduce these painful sensations and stiffness that patients experience. Am I right? Is that
Exactly,
correct?
exactly, sir. You are right on.
Yeah. So please go ahead. Yeah. What is the things that
So
you would recommend?
initially, whenever we are waking up in the morning, we our body needs a little warmth. So what we can do whenever in we are in the bed, 5-10 minutes we can spend on some range of motion exercises, some neck movements, some shoulder movements, some calf movements. So all these activities will increase lot of warmth, local warmth in the muscle, and it will eventually take little more blood supply, and eventually it will enlarge or elongate. So that will help you to reduce your muscular stiffness, and eventually it will help you to reduce your joint stiffness, because joints are moving basically with the muscles. So if your muscles are moving fine, your joint is going to be little fine only. So that will reduce joint pressure by doing all these warm up exercises. Second thing you can do is, whenever you are waking up in the morning, initially you should start walking around 5-10 minutes or 10-15 minutes of walk. So those kind of things, because walking is again some whole body movements, will include some so basically all the functional activities you are doing in the morning, that will help you to reduce your this stiffness formation and pain and aches in the different areas of your body. So I want to highlight one thing, that there are multiple things for multiple age groups. So right now age groups are suffering more from the cold weather, will be somewhere around 40-45 to till 60 70s later ages, you know because younger population will not feel much kind of this symptoms, because they are not they are active enough, their muscle strength will be somewhere you know near to normal. Ho- with age, your muscle properties will change, your joints, some degradation is happening, or some associated conditions will be already there. So that will lead little more changes in muscles and joints with the temperature drop. So all this temperature drop, predisposition to all these things is also adding few things in. Already whatever condition you are having, it is already adding few more things to that, so eventually it will show up little more in the winter. So those peoples can do some static stretches, some range of motion exercises. Walk is the one of the better option to warm up your bodies. So this kind of things you can definitely try to reduce your symptoms in the morning if you are having a lot of stiffness or the you know pains in the morning.
Okay, so just to summarize, what you said was that some patients, especially some people, especially people who are of the older age group, are more likely to experience these problems than the younger people. But one thing which definitely helps is movement, any kind of movement, especially some mild stretching or even some gentle walking around as well, some 5 to
Yes,
10
yes.
minutes. So that can get the blood flowing and improve the blood supply, and therefore also reduce the stiffness that the patients are experiencing.
Yeah, and one
So,
more thing, sir, I want to add in this, because I have mentioned multiple exercises, here. So I want to uh, tell our viewers that we already uploaded our video of set of exercises which you can follow at home. So it is with explanation of each and every exercise, with bunch of 6-8 exercises which you can follow as a mobility, because it is general exercises which is not focused on particular joint or particular muscle, but it will definitely gives you little mobility and some muscles. So that also you can start following. It will be in the description of this video, so you can definitely go there and check out that video.
okay, that's excellent. So, people who are seeing this video, there is a link in the description below. And if you click on that link, you will be taken to a video which is created by Dr. Shivraj, consultant physiotherapist, where they've shown simple stretching exercises which can help you to reduce the amount of stiffness that you are all experiencing. So, if anybody has any comments or any questions during this session, please do type it into the comments and we will try to take it up during the session. If not, we will answer it later on as well. So, please do type in any questions or comments that you might have, either for Dr. Shivraj or for myself. So that is so the important thing is that we have to do some kind of stretching or some kind of movement And as you said in the introductory video also, movement is medicine, right?
Yes,
In this particular situation, to reduce the stiffness and to make the patient comfortable, they have to move. And in fact, patients might find it very uncomfortable in the beginning to move, but that uncomfortableness will last for a very short time, only 5 to
yes,
10
yes.
minutes. If they just persist with the movement for more than 5 minutes, then they will definitely feel a huge amount of relief. Am I right, Dr. Shivraj?
Definitely, sir. Definitely.
So that initial 5 minutes is the only hurdle that patients need to pass, and therefore, uh, uh, I can reassure all the patients and tell them that anybody who's not in the mood to exercise and who's feeling somewhat and just wants to remain seated, just get up and just move around. Just move around a little bit, whatever you want, for just 5 minutes. Aim for moving for more than 5 minutes, and you will see that that 5 minutes itself will make you feel better.
Yes.
In addition to that, if you are able to see the video created by Dr. Shivraj regarding gentle stretches, sorry, that will also definitely help you. What are the other things that patients can do to reduce stiffness?
So there are multiple external things which patients can do is like provide local heat. So either it can be in form of hot water showers or some heating pads, because again reduced blood supply to the areas is main problem. So this kind of heating, external heat will definitely helps to ease down little bit of stiffness and some pain related stuff. Because in cold, one more factor is like your nerve conduction will increase, so your sensitivity towards the pain will definitely increase with that. So if milder pain sensations also looks like it is little extreme pain or kind of stuff, so that's where nerve conduction will also ease down with local heat. So that will also help you to reduce your pain sensations eventually. So this all things you can definitely try.
So using a
And
hot water bag or
yeah,
taking a
some hot
hot
water
shower
shower. Yeah,
is what you would recommend, and that will help you feel a little bit better. And in fact, that might help you to do the exercises or the movement also easier, right?
yes.
So one thing you can do is to schedule 5 to 10 minutes of exercise after a hot shower. If you're using a hot bag, then of course you should be very careful, because sometimes you can develop some burns due to application of the hot bag. So always that is one thing that I tell all patients to be careful about, because I've seen many patients who have applied hot bags to their knee or to their other joints when they're having severe pain, and they've ended up developing skin burns due to the hot bag. In addition to that, what is the role of hydration in this situation, Dr. Shivraj?
So hydration is also one of the major part which plays in developing muscle stiffness eventually. In winter, what happens, because temperature is low, our body is losing less water from the body, and eventually will not feel that much of thirsty. So eventually, what happens, because our body temperature is same, that water loss is still happening, but we are not getting that thirsty sensations too much. So we'll eventually have less water compared to some summer, or like if you say monsoon. So in winter, especially we are having less water, and less water eventually thickens the blood, because blood, our 70% body is water. So if you are not having enough body, your blood in the body will also thickens up, and eventually it will further add-ons in vasoconstriction. So where your vessels are already narrow, and if your blood is thickened up, it will definitely reduce a lot of blood supply to muscles and all these things. So if you are hydrated enough, that will also help you to you're keeping your blood little thinner, and help you with the reduction of the spastic, like stiffness of the joints and the muscles.
That's a very relevant and important point. I agree, Dr. Shivraj.
Yeah.
During winter, especially because we are not drinking enough water, and some people, especially elderly people who have joint problems, or who have diabetes, they don't want to go to the loo repeatedly to pass urine. So they might artificially, I mean, they might purposefully, they might reduce the amount of water intake. And what I've seen is that that leads to an increased risk of cramps,
Yes, yes,
them developing cramps, right?
yes.
So proper hydration is important even during the winter. You can drink warm water, or you can drink some herbal teas or something like that. But definitely, it is important, as Dr. Shivraj said, to be regularly intaking fluid. In now we are having questions coming in. So a very relevant question, and we were going to speak about it next. So Somya asks, are there any medicines or supplements specifically recommended for winter? So I think I'll answer that. So one of the very important supplement which is recommended during winter is vitamin D. So, in fact, I was speaking previously about something called a seasonal affective disorder, where during the winter season or during the rainy or cloudy season, our mood becomes low. And during that time, exposure to sunlight is, of course, very helpful and important to help you get over that. But another thing which has been shown to probably help is vitamin D supplementation, because vitamin D levels also drop suddenly during the winter and during cloudy season. So definitely vitamin D supplementation is something that you should think about, Somya. Sarita asked, should I tweak my exercise routine when it's chilly outside? So what would you answer to that, Dr. Shivraj?
Yes, sir. So,
The
can you
question
still
is,
come again
should
with this
should the
question?
exercise routine change when it is chilly?
Yes, yes. So, exercise routine, basically it is not completely change your whole plan of exercises, but according to, if you are getting symptoms of muscular tightness or stiffness, then definitely there will be some changes in your program, if particularly you are getting in the winter. But if you are following one pre-existing exercise plans, then there is no necessity to completely change those kind of exercise plans. If you are having any symptoms which is giving you pain or uneasiness or some stiffness or some reduction range of motions, then you should consult doctor, and then you should think about your uh, plan to change your exercise routines as such, because eventually exercise will definitely give create local any kind of physical movements, like any kind of muscle movements will give you similar warmth or activation of the muscles. So if you are doing generalized body exercises, then definitely you can continue with the same program.
Thank you for clarifying that, Dr. Shivraj. So basically, Sarita, as you heard, you don't need to make any major changes to your exercise routine. But as we just discussed, remember to maintain proper hydration. Just when it is chilly outside, we don't drink enough water, and that can lead to our muscles cramping up, or it can reduce, it can in fact worsen things by causing dehydration as well. In addition to that, always remember to make sure that the core area of your body is covered, that you're not losing too much heat when you're outside, that you're properly covered and warm even when you're exercising. I think these are the two precautions that you need to take. Otherwise, the routine probably does not need to be changed. So, we spoke about how in winter uh, the uh, in reduction in the blood supply due to the change in the size of the blood vessels called vasoconstriction can occur, and that can cause stiffness within the muscles. In addition to that, we also spoke about how the thickness of the fluid in the joints can also increase, and that can cause stiffness in the joints. Our sensitivity to pain also increases, and therefore we feel more pain during winter months or in rainy months. And Dr. Shivraj also mentioned about how movement is something which is very important to help get rid of this stiffness. In fact, it is a normal tendency to sort of clamp down and not move during winter, but we should fight that tendency. And once we start moving after the initial 5 minutes, we definitely will feel much better, and we'll feel a reduction in the stiffness also. One important pointer that Dr. Shivraj gave was either to use a hot bag or a warm bath before exercising, and that will sort of help you feel better and get you moving faster. In addition to that, based on the questions that were asked by Sarita and Soumya, suggested that there's no need to change the exercise routine, and vitamin D supplementation is something which you can take in the winter. Your doctor can prescribe that to you, and it's very important to maintain hydration as well. So, with respect to the type of exercises that are done, like Sarita was mentioning about her exercise routine, is there any difference with respect to the type of exercises that would be preferred in this kind of scenario when patients are experiencing joint pain and stiffness or muscle pain and stiffness during the winters? Would you mention gym kind of exercises, or would you say that walking or yoga kind of exercises, or which are the kind of exercises which would be most preferable in this scenario, Dr. Shivraj?
Yes, sir. I'll definitely throw some light on it. So basically, exercise have multiple types like high intensity exercises, low intensity exercises, impact exercises, non-impact exercises. So according to your weather changes and your joints are reacting according to it, your exercise is also not changing in much. But if particularly your joint stiffness is persisting, then you should go towards more, joint mobility related exercises. If your muscles are painful, or it's cramping or becoming very tight, then you should focus more on the warming up exercises, which includes static stretches or some continuous range of motion activities or exercises where your muscles is contracting and relaxing in complete motion. So what happens if cold muscle or cold weather will be there, your muscles continuously in contractile position because it is guarding your body, and it is supplying lot of blood supply to your organs, which needs maintenance of temperature. So eventually your muscles are less with the bloods and less with the nutritions, it will be tight and stiff. So its contractile mechanism is not completely 100%, it will be somewhere around 70-80% if it is tight. So to uh, take it up to 95-100% contraction of the muscle, we need a lot of stretches or some warming up exercises, which is preparing your body to take that much of load for the future exercises. So if you are following proper warming up protocols, whether in winter or any regular days also, your injury chances are coming down to drastically 70-80% reduction in your injury chances if you are doing proper warm-ups and cool down before and after exercises. So it is for your 365 days working out life, you have to do warming up. But in especially winters, you include few mobility related exercises, which is helping you to move your joints better, and some static stretches, which will definitely improve your muscle length, which is already contracted because of the cold weather. So those two things you can definitely add if you are doing any high intensity workouts, any weight liftings, or any particular area where you are focusing particular exercises. So these things will definitely help you to reduce your injury chances, as well as it will help you to reduce your cold related symptoms as well.
Thank you, Dr. Shivraj. So basically, to summarize, focus on warm up and focus on stretches, right?
Yes.
If I have to summarize. So Shilpa is asking, are heat packs, warm baths, or topical creams safe and effective for me? Shilpa, I'm not sure for you specifically if you're asking because you have some problem, but unless you have some skin condition, definitely all of these things are safe. You can use topical NSAID cream or topical painkiller cream like Move and other things. You can also use heat packs, and you can also use warm baths. But as I said, when using heat packs, you have to be careful because some patients, if they have kept the heat pack, it's very hot and they've kept it there for very long. This usually happens when the patient is having severe pain in a particular area, and that is when they keep the heat pack for too long. But if you keep the heat pack for too long, then you can develop skin burns. So that is the only thing. If you have any skin condition or skin infection, then definitely you cannot or should not use heat packs or topical creams on that area. But warm bath is something that anybody and everybody can use, and that should be safe for you. And definitely, I think it will be effective as well. So I hope that answers your doubt, Shilpa. If anybody else has any other doubts, then please do put it in the comment section. We'll try to take it in the next few minutes, or at least even after the session. So we discussed about what causes the stiffness. We discussed about uh, who are the people who need to be concerned about this. It usually troubles patients more who are slightly older, that is 45 to 70 age group. That is what Dr. Shivraj mentioned. And we also mentioned about what you can do, that is local warmth or general warmth, some amount of movement, especially warm up exercises and stretches, maintaining hydration, and regular vitamin D. Now, coming to rheumatoid arthritis and osteoarthritis, uh, I've had a lot of patients asking me whether the arthritis worsens during the winter. So as we have been discussing, everybody feels that their muscles and joints are sort of tight, and as we had discussed, during the cold, your sensitivity to pain can go up. So definitely, the pain related to arthritis can worsen during winter, but there is no real evidence to show that the disease significantly worsens during the winter. In fact, if I have to go by my own anecdotal experience, meaning my own experience, I would say that it doesn't worsen during the winter, because I have fewer patients who come in during the winter than during, let's say, the summer or something like that. I have more patients who come in with pain and swelling during the summer. But of course, that is just based on my experience, and it's not proper information. But when scientists have tried to do research, when they have followed up patients during the summer and winter, in some research studies, they have found that, okay, slightly the disease might 16% it might worsen during the winter, is what the researchers in one Italian study found. But otherwise, most of the other studies have found no major variation according to the weather. So definitely, arthritis patients do not need to be worried that winter or cold weather or rainy season is going to worsen their disease. Now, apart from the elderly population, as Dr. Shivraj said, arthritis patients are another set of patients who can develop worsening of the stiffness and all during this period. And apart from being regular with their medications, they can also implement these things: maintain proper hydration, make sure that you're taking vitamin D supplementation, and some amount of warm up exercises and stretches, as well as some local heat or hot baths or hot heat pack application. So these are the things that are common to both people without arthritis as well as with arthritis. So I don't think there's any difference with respect to the advice. Would you suggest any differences or any other advice for patients with arthritis, Dr. Shivraj?
So, almost all the points or all the topics we have already covered. So, whether it is arthritic population or some elderly populations, uh, you have to keep in mind that your like disease or whatever arthritis thing is not getting worse, as sir mentioned. It is just surrounding temperature is changing, some physiological changes are there, that is just giving you little bit of extra pain or extra stiffness. But your disease process or your arthritic whatever things are there, it is still in control. You should not get worry or anything about it. It is completely fine. You just follow your regular exercise routines and medications, you will be fine. Okay.
Yeah, that is what I reassure my patients as well. So Ratish asks that says that in winter he feels more heel pain. Yes, Ratish, we discussed in the beginning of the video why people can experience more pain due to any reason, due to any condition, or even if they don't have any medical condition, still they can experience pain and stiffness in winter, or even in rainy season. So you can just go through those points again. I don't want to repeat them, but uh, what I wanted to say is that uh, there are certain scenarios where, like I've had situations where people have had pain and swelling in their joints, but they have been late. They have not come to the doctor because they have felt, oh, it's just cold weather related stiffness or cold weather related pain. So there are certain scenarios definitely where you should consider meeting a doctor, specifically a rheumatologist, as early as possible. So these are situations where if you have early morning stiffness lasting for more than 30 minutes, so if you're totally stiff in the morning and you're not able to move, and that stiffness, in winter it's very common even for normal people to have a little bit of stiffness which lasts for 1 or 2 minutes or maximum 5 to 10 minutes. But if it is lasting, especially if it is lasting more than an hour, then you need to meet a doctor, or specifically a rheumatologist. In addition to that, if you have any swelling in a particular joint, if it is red, if it is warm, then that is not due to the cold or anything like that. It is probably due to a medical condition. That is also the situation in which you need to meet a doctor. If you're having other problems apart from joint pain, so you're having pain and stiffness, but along with that, let's say you have a rash, you have fever, so if that is also suggestive of a medical condition, and you should not sit at home. You should go and meet a doctor. If you are having pain which is waking you up at night, so the pain is like you might, all of these problems that you experience are something that is there when you're awake, but once you're asleep you generally don't have any problems. It's only when you wake up in the morning that you experience a little bit of stiffness and uncomfortableness. But if the pain is waking you up at night, then also you have to consider visiting a doctor. And last point is, if you're having any impairment, that means that if you're not able to do any normal daily activities which you were able to do before, so just wearing your clothes, taking a bath, going to office, walking a few steps, walking up and down the stairs, if you were able to do this before but you're not able to do this now, then definitely you need to meet a doctor. Don't think it's just due to the cold weather. So in these particular scenarios, it's very important to seek medical help at the earliest. So I think we have covered all the points, Dr. Shivraj. Anything else that you wanted to add in summary? Because we are
Yeah,
nearing
so
the end of our this thing.
one more point I'll want to add is like most of in Bangalore specifically, a lot of population is software workers or IT related population, we can say. So those peoples are working continuous 8-10 hours by sitting in one particular position for continuous 8 to 10 hours is long working hours. So in particular, those kind of viewers or like not patients but viewers specifically who having minor here and there neck or back related stiffness, which is definitely gonna increase because main thing is nobody is following proper warm-ups and cool down and exercise regime is because they are not having enough time. Okay, so continuous 8 or 10 hours of sitting on one particular position definitely hurts your particular joints in the winter more than other seasons because already we mentioned all the reasons why it is gonna happen. And one more thing, there is about posture is like there is no one particular posture is good for your all over sitting or whatever work related stuff. So most of therapists or most of ergonomists will give you one particular posture that this posture is good, but one posture for any point of if you are staying in one posture for 15-20 minutes, then also it is not good. Dynamic posture is one of the best posture. So if you are working continuously in same position, it is not good for your body and your joints and your muscles because it will definitely give you stiffness if you are holding that for continuous so many hours. So every 45 minutes or half an hour, take 2 3 minutes of break, have few sips of water, or minor walking. 2 3 minutes of walk also definitely helps to unlock your joints from that stiff positions or bed posture, we can say. So sitting is new smoking. Everybody is talking about it. So I wanted to add one more point into our today's video, that those peoples also can do this kind of stuff. Small things definitely show big results in end of the day. Okay, so
No, that
small
is
small habits
yes,
definitely.
that is true. Yesterday only I read a research study which showed that just getting up for 5 minutes every 30 minutes, just getting up for 5 minutes and either stretching or walking around and then sitting back up and continuing to work. Just doing that is something which shows remarkable effects on your blood sugar and other metabolic parameters.
Yes.
So, not only from the joint point of view, but from your heart health, from your metabolic health as well, it
Definitely.
makes a lot of sense to just get up and stretch. And this is a very important and useful point that you made, Dr. Shivraj, that no position is like perfect, right?
Yes, yes.
Any position, even if it is like very well ergonomically designed, even in that, if you are sitting in that same position for a prolonged period, your joints and muscles are going to become stiff and you're going to feel uncomfortable at the end of the day. So movement, again, coming back to the main thing that you said, movement is medicine, and we need
Yes.
to take that medicine on regular doses throughout the day, right?
Throughout.
So thank you, Dr. Shivraj. I think we've crossed the time actually.
Yes.
So I hope we've been able to answer everybody's questions. If anybody else has any other questions, they can put it in the comments. We'll try to answer later on. So with that, I think we can conclude this session. It was a very, I hope it was a very informative session. We discussed about why this winter can worsen joint pain and stiffness, not only in patients with arthritis, but also in normal people as well. We also discussed about what to do about it. And we discussed about how the most important thing is movement, and regular movement, regular stretches especially, is something which can help you to fight against these problems. So with that, I think we can conclude the session. Thank you, Dr. Shiv.
Yes. Thank you so much, sir.